Let's talk tradition. Let's talk traditional wedding. Let's talk traditional wedding. Let's talk traditional wedding. ETO IGBEYAWO tó ń bọ̀ ní lọ́gbọ̀n. Let's talk traditional wedding.
ETO Let's Talk Traditional Wedding ó lọ lọ́wọ́.
Let's talk traditional wedding. ETO IGBEYAWO tó ń bọ̀ ní lọ́gbọ̀n. Let's talk traditional wedding. Every Tuesday on Instagram, every Tuesday on Facebook, 6 p.m. UK time. Every Tuesday on Facebook. ETO IGBEYAWO tó fún mi lóye. Let's talk traditional wedding. ETO IGBEYAWO tó fún mi lóye. Let's talk
traditional wedding. Hello everybody, and thank you for joining us on today's episode of ETO IGBEYAWO. Ẹ káàbọ̀ sórí ètò yẹn yìí tèmi nílé lóko lẹ́yìn odi mo kára lé mo kéré ọ̀nà mo kọ́kùnrin mo kóbìnrin mo kọ́mọdé bẹ́ẹ̀ ni mo kí àgbà wípé ẹ káàbọ̀ sórí ètò yìí lórí ètò láwa ètò wa ètò yín ètò kan náà tí gbogbo wa mọ̀ sí ETO IGBEYAWO. Let's talk traditional weddings and more with Meettheroyals. Àmọ́ gẹ́gẹ́ bí ṣe wà lórí ètò ikú tó di pé aṣọ nǹkan ṣẹ́rí pé yẹ ká júbà ọba kọ́dá ayé ọba ṣẹ̀dá ọ̀run ọba àná ọba ìní ọba títí ayérayé kan ìkése ẹlẹ́bùrúkẹ́ ọba tó tó nípa tó kàn tí ò pani tó ṣe pé ṣe ló tún pani mọ́ ọba tá a dágbére fún lọ́sẹ̀ tó kọjá pé à ń lọ kábọ̀ tó jẹ́ kó tún ṣe ṣe fún wa láti wà ń bí lẹ́yìn láyé àti láyé rere gẹ́gẹ́ bí mo ṣe máa sọ fún wa ní ọ̀sẹ̀ọ̀sẹ̀ Olúwabùnmi lèmi ń jẹ́ aya Òṣìbẹ̀rù tí wáyé mọ̀ sí Bùnmi Meettheroyals alága ìdúró alága ìjókòó MC olóòtú ETO IGBEYAWO with Godly Swagger. Guys, the show is about to start. It's another Tuesday afternoon, ladies and gentlemen, on your favorite show, ETO IGBEYAWO. Let's talk traditional weddings and more. Where we talk about everything Nigerian traditional weddings. We talk about marriage. We talk about home. We talk about lifestyle. We talk about family. Yes, we are starting today's episode. Please let people know that the show has started. Eba wa kesi àwọn wípé ètò ti bẹ̀rẹ̀, we are starting, and today we have a very special edition to come and give to us on this show. You know that we don't bring nonsense. But before we do that, I just want to remind us again, people, that our books are still selling on Amazon. If you're yet to get this book, The Evolution of Nigerian Traditional Marriage, this is a book that is also known as the Encyclopedia of Nigerian Traditional Marriage, where it talks about Nigerian traditional marriage, past, present, and future. If you want to know anything about how Nigerian traditional marriage started, this is the book to get. It's on Amazon. You can get it on Amazon. Very soon we'll bring it onto the TikTok shop. So we're still trying to figure out how that can be done. In case you're wondering how Nigerian traditional marriage used to be done back in the days, how it is done now, how it is likely to be done in the future, not just Yoruba traditional marriage, I'm talking about Hausa, Igbo, Yoruba, and so many other tribes in Nigeria. It's on Amazon, Evolution of Nigerian Traditional Marriage. You can grab it. And also, we do have the Dictionary and Idioms of Nigerian Traditional Marriage, Dictionary and Idioms of Nigerian Traditional Marriage. If you want to find out about this one, it will soon be on Amazon by this time next week. Yes, by this time next week, it will be on Amazon. So if you need it, please be patient. We're going to put it on Amazon so you can grab it very soon. And our third one is yet to be launched. That's called the Nigerian Traditional Marriage in the Face of the Law. What does the law say about Nigerian traditional marriage? It's coming out soon, so be on the lookout. Okay, the show has started, people. Remind people that the show has started. Tell people that the show has started. Start tapping, start sharing, especially on TikTok. If you're on Instagram or you're on YouTube, if you have a TikTok account, most of the conversation is going to be happening today on TikTok. But if you do not have a TikTok account, it's okay. You can stay on Instagram. You'll see us. We will talk about it, and we will be discussing about it. But you can hear us. And I do have a special guest today. But before I talk about my guest, I want to quickly mention what the topic is about today. The topic of today is who should be responsible for birth control in a marriage, or well, in a relationship. Let me put that way, because not every relationship is in marriage. Who should be responsible for birth control, men or women? Should men be the one to take birth control? If you think men are the ones that should be taking birth control, why? If you think it is women, why? Please, people, share this show. Tell people that the show has started. Remind people. People always come towards the end and they will start asking us questions. Oh my God, what was the topic? I think I've missed out. Tell people that the show has started. Share, 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 share. And as I said to us, we are on YouTube, we are on Instagram, we are on TikTok, but most of the conversation today will be happening on TikTok, and my guest is on TikTok. Before I introduce my guest, I'm not going to be on TikTok, on Instagram, or on YouTube. I want you to just, let me know. Birth control. Do we even know what birth control means? How many of us know what birth control is? What's a birth control? What do you mean when you say birth control? What does it mean? And who should be taking birth control? Men or women? Please, people, I need you to be involved in this conversation tonight. If you can hear me, make sure that you're saying something. If you're not active, I will not know that you're there. And keep tapping, tap, 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 people, especially on YouTube, on TikTok. Tap. That is how TikTok will not, push our live to the corner. That is how everybody will know that we are live. Hit the like button. Keep hitting the like button, keep tapping, keep telling people that the show has started. And of course, you know that on TikTok as well, you can gift us, that's entirely up to you. Keep tapping, guys, be active. Let's know that you are there. Thank you, Pebbles and Coco. I can see a lot of people are tapping already on TikTok. I can see, thank you so much, Delicious. Thank you. Please, people, yay, thank you. Please, you guys, I am relatively new on TikTok, so if I don't get it right, just bear with me. I will get there on one of these days. Yeah, Baba, thank you so much for joining on Instagram. Thank you so much, Kuni Yarika, for joining on TikTok, on Instagram. Thank you, Faye. Thank you, people. Please encourage someone to join this show. This is something that you're going to really enjoy. And again, I'm going to repeat. The topic that we're going to be talking about today is who should be taking birth control, men or women, and why do you think so? If you think it's a man that should be taking birth control, why? And if you think it's women, why? Why should it be women? Why can't I want us to talk about this. And what are the available contraceptives that are available for men? What are the ones that are available for women? What are the implications of whoever is taking it? What's the implication on them? How does it affect them and stuff like that? That's what we are going to be talking about today. Keep tapping. I'm just waiting for us to have more viewers before I go deep into today's topic, and before I introduce my guest. So please comment, guys, and send me an invite for you to be on the show as well, especially if you're on TikTok. If you have something to say, I'd like to have as many people as possible on TikTok so we can discuss this thing in full. If you want me to bring you on board on TikTok, please just indicate, and I would love to invite you to join the conversation tonight. Okay, I'm going to introduce my guest. My guest is very special. I'm going to introduce her. Some of us know her because she has she's once been on this show before, long time ago, and then we're bringing her back again today. So it's not new. She's not new to some of us, but to some of us, she is quite new. My guest is Dr. Olusheye Arikawe. As I said to us, she is a GP. She specializes in women health, and she also she's the founder of A Word for Her, which is an online platform where she talks about health, faith, and then how women can go about their health and also include their faith. So she is I don't even know how to say all this name, but just say them because they are so deep. MBCHB, FRCGP, DRCOG, DFFP, PGAMA. So that, if you know about medical terms, you know that she is a gap when it comes to medical line. I can't even explain all those things, but I know that she's almost like a professor of medicine. Let me put it that way. So people, I'm going to bring in my guests. So if you want to be, I'm going to send invites to as many people as possible. If you want to be in the show, please kindly accept my invite. I'm going to thank you. Those that are keep tapping, oh people. Somebody send me a message. Keep tapping, keep tapping, keep tapping. Instagram. I'm trying to bring in my guests. Give me your team, Mora. Yeah, I just invited my guests. Sis, if you can see me, please kindly accept. Thank you. If you can see me, kindly accept. I'm still waiting for more people to join as well, so please bear with me. Keep tapping. MC Monite, it's nice to see you on board, man. God bless you. Okay, welcome, Dr. Arikawe. Welcome on board, ma'am. God bless you. Yes, we can hear you loud and clear. So everybody, please let me welcome Dr. Arikawe. Tap, tap, tap. Let's welcome Dr. Arikawe. Let's welcome her on board. This is Dr. Olusoye Arikawe on board, everybody. Let's celebrate her. Let's make her feel welcome. Whether you're on Instagram or on YouTube, please let me know that you are there. Please make yourself active. I would rather have, people's comments, people's messages. That will go a long way. Thank you. And if you're on TikTok, please keep tapping. It's very important that you keep on tapping so that people that know that you're here. So people are welcoming you, ma'am. People are saying welcome on the show. Thank you for joining us, Dr. Arikawe. Okay, I have done a little bit of introduction in my own little way, and I would love to meet you, ma'am. Please tell us about yourself, Dr. Arikawe. I would love to meet you. Please tell us about yourself. Introduce yourself to us in a better way. Thank you, ma'am. God bless you.
Good afternoon,
We can hear you, ma'am. Good afternoon, ma'am.
So my name is Meettheroyals TV. I'm a GP, but my special interest is in women's health. I run women's health clinic. I know today we're talking about contraception. That's one of the things I do. Part of my work as a GP. I run a clinic where I talk to women about contraception, menopause, and I also do other things like teach and train. I run that with this clinic, but for the purpose of this talk to them, yes, it's mainly going to be focusing on women's health. And as the host said, I have a passion for women, helping women to connect the facts of medicine with the truth of God's word. So I write a blog on a word for her, where I, like I said, discuss topics which brings in the connection between science and faith. And I'm married an adult daughter as well. That's me in a nutshell.
Hey, everybody, please let's start to give Dr. Arikawe some warm welcome, everybody. Whether you're on Instagram, please let's show some love. Thank you so much, Dr. Arikawe, for joining us this evening. She had just introduced herself, and she also wrote another book. I don't think she remembered to mention that, or did I miss that out? She wrote a book about menopause. Yes, please tell us about the book. She has a book on Amazon. It's a menopause. Yeah.
Yes. So in 2020, I launched an ebook called How to Make Menopause a Positive Experience. So the book is available on Amazon. Called How to Make Menopause a Positive Experience. It's talking about what can women do. Women go through menopause. Sometimes it's hard, really hard, but you can actually make it a positive experience. You can go through menopause as a whole. So that ebook has lots of tips. How do you navigate menopause? And if there's Christian women, there's a chapter in it about what does God or the Bible has to say about menopause. Do you know that there's some Bible verses that actually relate to menopause? And what does God say? What can you do as a Christian woman? So that book has lots of tips and things that you can do yourself, something you can do to help yourself. to navigate menopause and to make it a positive experience. Also
Okay.
for men, not just for women.
Okay.
I've seen men also read the book and said, oh, they don't understand why their wives or their partners or their mom or their sister is acting the way they are, and what can they do? How can they support the women in their lives? So this book has got all of those tips. Thank you.
Thank you so much, Dr. Aikawi. So you guys have heard there's a book that she wrote, very good book. I've read the book on how to make menopause a positive experience, and it's on Amazon. So if you want to get that, and just type the name of the author, Dr. Olusegun Aikawi, is there for you. He's talking about everything that you need to know about menopause. It doesn't have to be until you reach menopause. It doesn't have to be that you're a woman before you read that book, and it doesn't have to be that I'm not that stage yet, so why do I need that book? No, it's not about that. It's about you getting the information even before you get to that side. So please, people, meet Dr. Arikawe. My Instagram people, I want to hear from you. If you heard Dr. Arikawe clear, can I see some thumbs up, please, so that I don't just assume that you heard her. If you heard Dr. Arikawe, please let me see some thumbs up. Let's make her welcome. Let me know that you heard her, so that I will not just be assuming that we heard Dr. Arikawe. And once again, Dr. Arikawe, welcome, ma'am. God bless you. And there's a lot of things that we want to talk about today. And this live might take a while. Somebody said I've sent a show to my husband so that he won't just think I am with my mood swing. It is well. So, people, we're going to be talking about a lot of things today. I will first of all start by asking Dr. Olusegun Arikawe, what is birth control? Birth control. When we say birth control, what does it mean? I'm trying to use that word birth control rather than contraceptive, because I believe that's a wider way of presenting this topic. Instagram people, please say something. Let me know you are there. If you're a woman and you know a woman that's that is somewhere that they will benefit from this, especially if you have challenges with your women health, it would be nice to have them here, especially. So thank you so much, Dr. Arika. Over to you, ma'am.
Thank you. And so, as you said, exactly as you said it, birth control. So it's how we use the word, you can use it to actually space your pregnancy.
Okay.
Let's say that you've had a child and you don't want to have another one as of yet. And also medically, it's not right to keep having kids one after the other in protection. As a woman, when you've had a baby, your body goes through a lot. It takes 9 months of all sorts, even the delivery process. So it's good to allow the body to go back to normal before you have another one. So the time that you choose between the first child and the next child, you can use, there are certain things that you can use to help you to space that pregnancy. Okay. That's exactly what that is. There are other uses of these medications that can be used for other gynecological conditions. The purpose of when you learn the birth control is to put a space between one child and another, and actually that's beneficial to the health of the mother. So that give you time to recover. A lot goes into being pregnant. A lot goes into having a baby. A lot goes into breastfeeding. A lot goes into everything that can test. So you actually need that to put between the thought and the pregnancy. And that's when you need birth control.
Oh, thank you. Thank you so much, ma'am. I don't know how many of us heard Dr. Arikawe. She's trying to explain to us what birth control means. Please, if you're online, if you have invited into this live show and you're not saying anything at the moment, kindly mute yourself so that we don't disrupt the conversation. She's talking about what birth control is. She's saying birth control is something that you can use to space your children, or maybe if you don't want to have any more children, what you can use to prevent yourself from having another child, maybe from getting pregnant. Yeah, Baba said interesting topic. We are listening attentively. God bless you, ma. Now, I understand that there are all different kinds of birth control. But before I go into that, I just want to say, in case somebody is saying, why is Meettheroyals bringing this particular topic up? The major reason why I brought this topic up today is to talk about, give us a better knowledge of the available birth controls, how they can be used, how it can affect us as individuals, and whether the gender looking thing, and also to be able to tell, specifically whether this birth control should be done by men or by women. So we are going to be talking about a lot of things today. And as your Baba has said, this is free information that we are bringing on board today. So please, if you know anybody that want to that that will benefit with, please share. God bless you. Now, Dr. Arika, sorry ma, what are the types of birth controls that are available? What are the types of birth controls that are available?
Thank you. There's so many different types. So to make it easier for us, I will break it down into two major types. We have the one that we call the short-acting, and we have the one that long-acting. Also to say that most of these methods are actually for women. And I'm sure you're going to ask me, why do you not just have, why are they all for women? So the short-acting ones, what that means is that it's something that you will use and that you can stop, you use the back legs, maybe just have it for a couple of weeks or for a year or for two. You can easily stop those short-acting ones. And the examples of those short-acting ones are like the pill. Everybody talk about pill. But when you mention the pill, there are two major types for women. We have the combined pills and the mini pill. There are drawbacks to each of them, advantages, disadvantages. I don't know how much detail you want to go into, but I think today just to give a general knowledge. One-to-one consultation, I would advise that you go to your GP together. So, like I said, we have the pills. We have the combined pill. Yeah. Some people are not able to take the combined pill because they have certain medical conditions. Okay. For those people, they would have what we call the mini pill or the progesterone only. The combined pill is both estrogen and progesterone. But some people are not able to take. For instance, if you have high blood pressure, if you've had a clot before, or you have a family history of breast cancer, or you smoke and you're over 25, or if you're overweight, if your BMI is above 35, you will not be able to take the combined pill. Or if you have a certain type of migraine, which is a type of headache that has some characteristics, you will not be able to take the combined pill, and you can have the mini pill, which is a progesterone only. So those are the short-acting. You take them every day for a month, and start again. That's why we call them short-acting. They need to take them every day without a break. And so they are called short-acting. But we also have the long-acting one. Those ones, they can last for a long period of time. And there are several types of the long-acting. One is everybody say the coil. So you can have the coil, which is intrauterine contraceptive device. There are two types, or main two types. We have the copper coil and the hormonal coil. The hormonal coil has got different types of life. So some of these coils can last for 5 years, some can last for 8 years, some can last for 10 years. So what that means is that once you got them fitted, you can keep them in for that time period. Okay. Of course, if you want to have another child, you want to fall pregnant, or you're not getting on with them, you can take them out. But they're called long-acting because they stay for a long time.
For a very long time.
Another type of the long-acting is the injection. So the injection will go another drug every 3 months. So that means you have it and it lasts in your body for 3 months. And you have to go again after 3 months after change. Another type of the long-acting is what we call the subdermal implant. That's done. It's an easy procedure. It takes a couple of minutes. They will put it like a small rod under your arm, and that stays up for 3 years. Again, that's also long-acting. So those are the major parts of the long-acting. But we have some other types of contraceptive, like the diaphragm, the caps. You can have the condom. You can have the patch, and you can have the vaginal ring. So there are different types. Long and long. Based on the individual, some will work for some people, some will not work for another person. Some also have some advantages and disadvantages, but there's so many options. So if one doesn't suit you, you can actually go and get another one. So it's just important for you to know that there are lots of options for you. And also we have the condom for men. So that's the only one.
This is the question. This is the question I'm about to ask. Somebody saying which one is for men. No, I was going to get there. Okay, he's mentioning one now for men because you should move around me. All these ones for women. Which one is for men?
Okay, well, so we have the condom.
Okay.
So that's the one that men could have.
Okay.
Yes. there are lots of methods that are currently being studied, but we don't have. It's still in the pipeline.
Wow.
So in the next 1 or 2 years, we're going to have other methods that men can use.
Wow.
Or as we speak, have the male condom for men. All these other methods I mentioned, the coil, the implant, the caps, the diaphragm, the mini pill, the combined pill, they are all for women. There's even a female condom as well. So women have so many options. There's a male condom, there's a female condom. There's a patch, there's there's patch, there's ring for women. But the condom is for the man.
Even we women, we still have condom on top of all this list.
Yes, that is true.
Wow. Okay. I'm gonna ask people that are online, whether on your Instagram, please note that you can leave us a voice note on this number 07863 245 793 07863 245 793. If you want to leave us a voice note on that number, we can play it for everybody to see. Now we're going to go about it this way, because this thing is not just for education purposes, it's also to kind of, you know, understand certain things. Why is it that we have so many contraceptives for men and we don't have for women? Now somebody said, when I had my last baby, my hubby and the doctor advised I go through tubal ligation because I easily I don't think that got finished. You know, I was just about to unmute people or to ask people that are online, please signify if you want to join the live. You know, if you want to join the live as women, let's talk about the implications of most of these contraceptives. What could possibly go wrong? What are the side effects of most of this on women before we move on to men? And please, I want to please ask women that are online, please unmute yourself. What are the experiences that you've had having having contraceptives? What are your experiences? What has happened to you? And it is it's not a very pleasant experience for some reason, and it is because or as a result of you having contraceptives. Please let me know. I think this person was trying to leave a message, but we couldn't finish the message. Please remember that you can always indicate to join us on this show. Bookilicious, are you there? I just want to hear from women. I love when people are also participating. I'm not just my guest. Please remember, I didn't get that question properly. She said I should let her answer that question. I didn't quite get that question. Mingle and Tingle circles. Please, I didn't get the question properly. Did I miss the question? She asked the question, I can't see. Can you rewrite it, please? I missed the question. So I'm so sorry.
There's another question there on vasectomy.
Okay, okay, is that from you?
No, there's a question on the thing about vasectomy.
Okay, go ahead, Ma. Can you answer that question first? Yeah, maybe that's the question she's talking about.
So vasectomy is a small procedure which men can have, and what that procedure means is that it's going to block, you know, so for men, for a woman to get pregnant, the sperm and the egg needs to meet. Alright? So what that procedure will do is that it will block the dot that carries, the sperm. The sperm is found in the semen. So the man will be producing semen during ejaculation, but that semen will be sperm free. What that means is that semen cannot impregnate
a woman. Okay.
And that procedure is a simple procedure. And I believe that strong men, real men, go for vasectomy. Especially if they're women, if their partners or wives are struggling. Because we're going to talk about the side effects, as you said, from all these methods for women. Some women have tried all different methods and they're struggling. They couldn't get anyone that suits them well.
Okay.
So sometimes men have come back and said, hang on, you've been pregnant, you've carried the baby, you've gone through so much, and I've seen how you're having lots of side effects to all these methods. How do you go for vasectomy? Procedure, which men can have. But typically it's available under the NHS. It's said to be a permanent form of contraception, but we having ejaculation. All it does is that they are producing semen that is free of sperm.
Okay.
That means that semen
cannot impregnate a woman.
So yes, vasectomy is available.
Okay.
They cannot.
It cannot.
So vasectomy is available for men. If a man's hair and your partner or wife is struggling with methods of contraception, please go to your GP, put your hand forward, and go and have vasectomy. It's a very simple procedure. It's done under local anesthetic. They will not put you to sleep. It takes about 30 minutes and you're done.
Wow.
So please go ahead and have vasectomy.
Do we have men on this live? Do we have men here? You know, men, can you hear? Because this is the question that this person has just asked me. She said my hobby and doctor advised me to go through tubal ligation. I think I got that wrong. Though I declined, then she's asking why can't men go for it, go through it. That is actually one of the major reasons we're having this conversation tonight. You know, why can't men go for all these things? Why is it always about women? You know, and because having to think about it, we women, we can only probably get pregnant maybe under normal circumstances. Maybe a woman get pregnant like 10 times in their lifetime. Let me put it that way, if you're really fertile. But men have the capacity of impregnating as many women as possible. So I am of the opinion that men should be the one to go for vasectomy or whatever they call it or whatever it is. They should be the one. They said the men are quiet. There are men on, but they are quiet. So why is it that it's always about women? That's what Dr. Alikawe had just explained to us. That the process of doing this is, it doesn't harm them. It doesn't do nothing. It doesn't hurt them. It takes very short time to do it. It doesn't stop them from enjoying sex. It doesn't enjoy them from, it doesn't stop them from enjoying, whatever. So why can't we do it? Now, let me read the comment that somebody said here on Instagram. Somebody said, I remember some times ago when I was going to take out the copper coil that I had. It was very difficult to the extent that I fainted. It wasn't a good experience. Why are men not doing this? Somebody's saying that. Now, compared to men, yeah, no thanks. I'm trying to read what this person said. Okay, please, I want to ask Dr. Alikawe. Compared to men, let's mention some of the side effects or complications that could occur in women when they take birth control or pills or whatever it is. Let's mention some of the complications that women can experience. Let's mention them. Are there anything like that? Is it possible for women to express some complications? Is it possible for women to, what are the things? Because I know people are online, but they're not willing to talk. Somebody just told me what they experienced. Somebody said, I experienced a very bad experience when I was removing the coil. It was so bad that I even fainted. So that's one nasty experience.
Can I please stop before Dr. Alikawe says something?
Sorry, go on.
Somebody was asking.
Go on.
Right.
Yes,
so,
please.
Just in regards to that question that you just asked, I'm just going to join two things together. So, sorry, this is Pebbles Online.
Yeah. Hello, Pebbles.
Thank you, Dr. Alikawe, for shedding light on this vasectomy of a thing. I'm one of those ladies that is of the opinion that maybe men are not allowed to have or should not have control. So I've got 4 kids, and I've always been the one to have contraceptive control throughout this my marriage. But there was a day my husband said he was going to go for a sleep, and I refused. I refused, and I said no, because I thought once you have it, that's it. I said, what if we want to have more kids? And well, after that, we had 2 more kids there. But then at that time, but now that I want him to have it, and although we've not spoken about it, but I know if I say it to him, he might then know and might say yes, I'm not asking. So I'm one of those that, opinion. But thank you for shedding light on that. I will honor my husband now. Please go and have this. And 2, side effects. Talking about, one of the health control that Dr. Alikawe mentioned, the one I've always had, I've had the coil once. I don't know which one I had. What I had, I bled so much. much that I had to take it out in 2 months. Then I went on to having the implants. And the very first time I had the implant, it was okay. For 3 years. After 3 years, I took it out, I had another one. After having the second episode of that, it's been hell. Now, going on, after my last baby, my mom decided to have it. I started on the pill. Because I'm not a good time to come with the pill. Then I decided to go back on the implant again. The implant that I've had for the past, I'll give it this. So I had it like in January up till like a month ago when I had to go and take it out. I've been bleeding like continuously, which it didn't go well with me. And I thought, I'm not going to do this again. So since that time, I just said, you know what, I'm taking it out. On the day that I was taking it, I was being put like the injection. I didn't even care what it was. I said to the nurse that was doing it, I said, you know what, I'll go home, tell my husband, whatever he wants to do to himself, he should do it. My body, so now that Dr. Ikari has shed light on this, I understand it more and I understand it better. Men can go for it. Me, as a woman, my body needs to be free, my brain, because it gives, apart from bodily side effects, there are like emotional ones. You do have mood swings. There are so many things that we go through, headaches and all that. So that's on my side. That's my, my own, and my own. That's my. And thank you to Dr. Arika one more time.
Thank you very much, Pebbles. Thank you for that. I mean, if on this show, which I believe quite a number of people are just joined us newly, you're welcome on the show. This is your favorite show, ETO IGBEYAWO. Let's talk traditional weddings and more. Tonight we're having a conversation about birth control. Which one is good, which one is the best, and blah 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 blah. What's good for you? How can you make a choice and stuff? But majorly tonight we are focusing on how men and women have so many choices of contraceptives and men barely have any. So we're talking about who should actually take contraceptives, come to look at it, come to think of it. So that's what we're talking about tonight. And we have an expert on this show tonight, a specialist in women health, Dr. Arika. She's a GP and she specializes in women health. So if you're just joining us, welcome on board. Feel free to join the conversation. Please send me an invite to be in the show. Please, if you see me mute your microphone, because there was some background noise going on, you can unmute yourself if you want to say anything on this show. And I'm going to quickly go through some comments as well. I've seen a lot of people say, when we're talking about what could happen, people said bloating, people said all sort of things. Somebody also is talking about depending on how long you've been married. Thank you. Somebody said hello everyone. Thank you, Mama Banke. Thank you for joining us. So going to what Pebbles said as well about the implications of taking contraceptive on her body, her health and stuff like that, and the fear she had. And she was actually the one that said her husband shouldn't take vasectomy, and what do they call it now? Baby. So Dr. Arika, ma'am, can you shed more light on this thing that Pebbles have just said?
Okay, thank you so much. Sorry to hear that you had all of that experiences with the methods that you tried. As I said before, there are lots of types and lots of methods. So sometimes you will try one and that may not actually. Can you still hear me?
Yes, ma'am, we can hear you loud and clear.
Okay, but you can't see me because my video is on. I don't think you can see me.
No, we can't see you. We can't see you. We can only see your picture.
But I put my video. I don't know what's going on. I tried to put the video.
Okay, maybe you should go off and come back. Sometimes he does that. Because we can only see your picture, to be fair. So I thought you didn't want to put your video on.
No, I wanted to. I'd like to hear, but I can't.
Oh, okay. Would you be able to go out and come back? I don't know what happened. Let me disconnect you and then bring you back.
Live access needed. Live on video as a guest.
Okay. Did I?
You have to give me the access.
Access. Really? How does that work?
You sent me the request for audio.
That's okay. How do I do that now? Oh gosh.
Yeah. Really just go on.
Okay, keep talking. I will see if I can get that sorted here. Keep talking,
My
ma'am.
video is on, but it's saying that I haven't got the access to do video. I can
Really?
only join
Oh, okay. I don't understand why that is like. Okay, keep talking, ma'am. So I will see if I can figure that out.
Okay, so
Yes.
when it comes to the different methods and the side, I will use the word side effect, maybe not complications per se. And that's why before you're put on any method, we will go through what we call counseling. You need to speak to the family planning nurse or a doctor, someone that will go over your medical history, your family history, do your examination, and then identify which of the several methods that we mentioned would be suited for you. Again, some people are very sensitive to hormones. Somebody was talking about the mood swings, about the headaches. So I talked about the combined pill, but there's so many types of the combined pill. Some people will take a particular type, which are the older version. They would have problem with their mood, with their headaches. And when they switch them over to the newer version of the combined pill, those that got a particular type of progesterone in them, all these symptoms they're saying would not be there anymore. So I think it's important to speak to a specialist. They will look at your symptoms, what symptoms are you having from a particular method, and they can switch it over. Sometimes you have to try different types. It's like a woman trying clothes on, finding what fits. Not that it fits everyone. So like, you do it now. Whatever you're wearing right now, I may wear that and it not suit me. So it's not what fits all. So if that's the same with you, you have to find what suits you. Find what fits you. So you need to speak to somebody that knows what they're saying. And if you tell them what your symptoms are, they can always change you over. And the most people will say, I give up. I'm not going to have it anymore. And then they start having babies that they don't want to have. Because they couldn't find something else. And I agree with you, the side effect can be, for some people, very unpleasant. Like I just mentioned about bleeding of the implant. So it's not unusual. Well, before I do implant for someone, I will say to them about the bleeding risk. 3 things can happen. You may stop your period completely, or you may start to get irregular bleeding, or you may get regular period. So I would say to a woman that all those 3 things can happen. But again, even if you are bleeding on the implant, we can actually give you certain medications. We can actually put it on the pill in combination with the implant. So put on the combined pill for 3 months, and then that can actually sort out the bleeding. That's if you have no contraindications to take the combined pill. So there are things that can be done. So some of these things can have bleeding, but we can give you some medications to stop the bleeding. Some people, we need to take something that's no hormones at all. You know, when I talked about the 12, I said there are 2 types. We have the copper one and the hormonal one. So the copper one is no hormones at all. So some people would be very sensitive to hormones. When you switch them to the copper coil, they are fine. But again, the downside to the copper is that it can cause heavier and longer period. While the hormonal one, like the marina coil, it can stop your period completely. Most of us African women have a problem with our period because of fibroids and all sorts. So the marina coil, apart from being contraceptive, we also have to stop and minimize the bleeding. And actually, 1 in 5 women that have the marina coil will not have a period at all for the 7 years or 8 years that they are on it. So it's not one perfect all. There are lots of different things that you can have, but we can always tweak these things over. We can tweak it. We can change the progesterone with the combined pill, or switch it from the combined pill to a mini pill. Okay. And the good things about those long-acting ones is that they are not dependent on you. You don't have to remember. Some people will forget to take the pill, and if you don't take it as you've been told to take it, it doesn't work for you. Because one of them is 100%. You can fall pregnant on any method. The only 100% is abstinence. So, but
Sick like me.
some of them are highly effective.
Ego.
Majority of them are highly effective. So, if one doesn't suit you, you take a different one. And just stop answer the question.
Oh my God. Pebbles, was your question answered? Pebbles, was your question? Yes. Okay. Okay.
My question has been answered.
Okay.
My question has been answered. But the only thing is, should I call them professionals that I spoke to, didn't ask for, I believe they would have my medical exam, and they should know what suits me. But they just put me on what they felt was okay for me. But thank you, Dr. I just really understand now. But as for me and my body, we are free.
You are free for now. Let me read comments. Somebody on Instagram, thank you, Pebble. Somebody on Instagram, MC One says, I try 3 types, not suits my body. My body keeps rejecting all. The last one inflamed my womb linings, and I have varicose vein in my womb. That's my top all. So I was just going to ask that question actually, Dr. Arika, when you said people can keep trying all different ones, like somebody just said now. She said she's tried so many of them and they kept on her body kept on rejecting it. Why can't I put you on video? I don't know what's going on. So she's saying her body rejected. It was even so bad that the GP had to ask her to stop because the health implication was just too high. Now, when women keep on trying all different kind of ones, when do you even know that you're going to get to the one that's that will suit your body? So one just keeps trying.
So again, I think it's important to. So it's not a matter of trial and error. So if somebody comes to me, you want to go on the contraception. What we do is after taking your history, after doing a full counseling, I would actually know right from the start that you are not even supposed to take this particular type. This will not suit you. So it's not like you start from the beginning. It's okay, take this. Okay, it's not working. Take this. No. So the purpose of the counseling is to say, for this particular person, based on your history, based on your family history, based on the examination I've done, you cannot have ABCD. For example, a woman comes to me, you already have them every period. You have fibroids. I won't put you on the copper coil because I know the copper coil, it can make your period heavier or longer. But we have some women that they said they don't want to take any hormones. They don't want any hormones in their body. I said to ladies, you don't have hormones running around in your body anyway. So why are you asking? Why are you running away from taking hormones, So some women say they don't want to. They want to go for the copper coil because it's the only one that is more enough to reliable that doesn't have any hormones. Most of the other ones have got hormones in them. The other one without hormones is a condom, and it's not as reliable as having a coil fitted. So already once you've spoken to the patient and you've taken some history from them, you can say to them you shouldn't take a copper coil because it will make your period heavier and longer. You are better off having a Marilla coil because it will stop your period. And if they are very sensitive, for instance, I will give them another hormonal coil with a lesser quantity of hormone. So we have some called Jades, we have some called Canina. There are lots of different types. If you cannot take the Marilla because the hormone is too much for you, you can give it the Jades. It's got a lesser amount of hormone in it. So it's a matter of finding what fits you. So we don't do like try and error. Try this, no, it doesn't work, try the no. Before we put you on anything in the first instance, this woman, should she be given the combined pair? If you already have migraine headaches, for instance, and you have migraine with aura, you are not even allowed to have the combined, but that will increase your risk of something like stroke and that kind of a thing. So we suit this woman. If you're already struggling with your mood, we would say, we can't give you the one with the kind of progesterone that will also make you struggle with your mood. I will give you one with a different type of progesterone that will not have any effect on your mood.
Okay.
So it boils down to having the right kind of counseling before you are giving anyone. So it's not just take this, it doesn't work, try this. No, why did it not work? What symptoms did you have? What can we do? If we give you this one, will you get the same symptom or will you get a different symptom?
Okay.
So it's getting the right one that fits or that suits you based on you and so many other factors.
Okay. Thank you, Dr. Arikawe. I've got a couple of questions here that I don't want us to miss. I don't know if any of the guests online, Total Event, thank you so much for joining us, sis. I really do appreciate you. Please, if you're online, if I've invited you to join this live, or you have sent me a request to be in the live show, feel free to interrupt at any time, because I might not be able to know whether or not you want to say something. If you want to say anything, please feel free to say something. Because I know that quite a number of people are online and they've sent me requests to join the show. I really want to hear from you. What are your experiences? What have you experienced when it comes to contraceptive? And of course, the major bottom line today, or the bone of contention today, is why is it that women are the only ones that are having so many? Which one of the questions have been answered? Dr. Arikawe said it is still in line of study to have more contraceptives available for men, maybe in the next 2 years. That is, I don't know, in this day and age, in this day of AI, men are still being studied whether or not they should have contraceptive. Somebody said men should be the one that should be having contraceptive. They should be the one that should do birth control, because they are the father of all nations. Precious Alloy, please ask questions. Do you want me to bring you on board so you can ask your question? I'm going to bring you on board. Please feel free to ask questions. This is an opportunity for you. I have brought a professional here today. Someone that will give you the correct information that you need. I don't know how many women out there are struggling with this. So, Precious, please feel free to ask your question. Feel free to unmute yourself and ask your question. And also, go ahead. Yes, go ahead. We can hear you. We are listening.
Okay, good evening, everyone.
Good evening.
I had an implant after, because I had my baby first out, then I tried the injection one. Before I think that, after that 6 weeks, I was feeling a certain way. I went to do tests and I was pregnant.
Okay.
So, I now do implant after I had my baby. The first year was a little bit nice. But when I got into the second year with implants, my flow was bad. My flow was very high. Now, at some point, it got to 3 weeks. I'll be stressing for like 2 weeks.
Wow.
Or if I do 2 weeks break, I have 1 week break. The next 4th week, we start me again.
Wow.
Then I have cramps. I can be driving, the pain will just come from the left. I'll just look for where I'll park. I will not be able to move, I will not be able to stand up. The pain is just too much. Normally, my flow does not last up to 7 days. And I don't have cramps. The headache is too much. That's it. My daughter has to ask me, Mommy, why do you always have headache? It's just bad. So what, for me now, usually I don't have a headache flow like that. It might just last 4, 5, 6 weeks. There is not again. On the implant, I started having heavy flow, I started having this pain, and lots of heavy mood swings. So, look for that actually go for now, because this copper one, too, some I've seen, my mom did copper one, and our last sibling came out with copper. So, I don't know.
I can imagine.
I'm looking for now. Which one is best to go for?
Okay.
Because to say it's actually important. I just came out from the GP and I was telling them that I feel so much pain and all of that. And they were telling me, oh, maybe I should do coil and all of that stuff. So,
to you, Dr. Arikawe.
So what I would say is, when you say which one is best, there's no which one is best. Is which one is suitable to you as a person. All right. So again, I want to mention that most of these symptoms we are talking about that could happen when you take or use one of these methods, you need to be careful. Sometimes the reason for some of our symptoms has got nothing to do with the contraception that we are taking. I've seen a lady that was bleeding regularly, and they all assumed it's because she's got, I think it was a coil or something. But they actually examined this lady. So one day she came into my room, she was so worried that she's not been able to have a smear test because every time she wants to come and have it done, she's having bleeding. And he said, no, it's because they're taking this hormonal contraception. I said, okay, go on the calendar and examine you. Lo and behold, she had cervical cancer. That was what was causing the bleeding. So sometimes we don't just quit the bleeding to the method. So if you're having lots of symptoms, it's important that they check. What if the person has got fibroid causing the bleeding? What if the person has got like a polyp, which is like a growth? You know, I mean, cancer is the worst case scenario. It's not that common. but it could be anything and anything. So if you put on a method and you're having lots of symptoms, you also need to check other things. Have they done a scan? Have you got fibroids? Has somebody done look at your cervix? Have you got your smear? Are you doing your regular smear? Have you missed your smear? So there could be one of different reasons why you're having all those bleeding. And if you have the implant, like I said, and if you're bleeding in the first 3 months of having the implant, they can also put you on the combined pill. If you take the combined pill back to back, that means you don't take a break after every month. You take it back to back for 3 months. Sometimes that will just settle the bleeding.
Okay.
But if I do any method, I'm not trying to cut you short. I have done scan because I reported this like 2 years ago. I did this scan. They said they didn't see anything. In fact, I was just thinking maybe I've gotten pregnant, but it's not in the right place, you know, like to be pregnancy. They did scan, they didn't see anything. No inflammation. Then when they gave me Buscopan, since I complained of pain, they gave me Buscopan, and it didn't stop. Okay, so again, scan will just show things like have you got fibroids, have you got like maybe like endometrial polyp, but there are other things that can cause painful period like endometriosis. You will see that on the scan. So you may need further investigations. The GP may need to refer you to the gynecologist. It might be endometriosis is one of the commonest causes of very painful and heavy period. So it could be that. Okay. So the point I'm just trying to make that we shouldn't just resign that this is just because yes, you can have a bit of irregular bleeding or all over the place with some of this method. But if your bleeding is becoming so heavy, so bad, and you are in so much pain, we need to check that it's not due to something else. Okay. So maybe you need to just insist, go back to your GP, ask for referral, see the gynecologist, get further tests done. Just cover all ground. Make sure you're not leaving any stone unturned. And again, as I said, if one method doesn't work for you, for most women that have very heavy painful period, the Marina coil works really well because it can stop your period for 5 years or 8 years. Even though it might take a while, we say you need to persevere. Stick with it for a couple of months, and sometimes once it starts to kick in and to work, you don't get any period at all. But it's difficult to say this is the one you should go for because I don't have your medical history, I've not examined you, so I can't really give a personal advice. But generally, I would say if the problem is heavy bleeding, yes, Marina coil sometimes works for that, and even if you have endometriosis, Marina coil is very good for that for people with endometriosis and all sorts.
Okay. Thank you, Dr. Arikawe. Precious, I hope your questions were answered. I think, like Doctor said, it might be good to check that it's not other things that are causing these things, because sometimes women we just generally assume that it has to be because of contraceptive. It could be anything else, like she has rightly said. And I love the word insist, because nowadays in this country, to get yourself checked might be a challenge. So we have to insist and keep going, because these days it's like they don't want to do nothing. So you have to just insist and make sure that you get yourself checked, because at the end of the day, it's your body, it's your health. And I hope that you are able to get solution to whatever it is. It could be the contraceptive, like Dr. Arikawe has said, but we don't have to just conclude that it is contraceptive. Thank you so much. I'm not sure if anybody else have any question, but while we are doing that, I'm going to read what this person said. The person said, please, and breast pain, heaviness, and change in size. I've gone to check with GP and they say it is okay and nothing to worry about, but the pain is there. Somebody is saying they're experiencing they're experiencing pain in the breast and heaviness and stuff like that, but the doctor said it's okay and nothing to worry about. If you're still worried, I think, like Dr. Arikawe said, it's better to keep checking. Dr. Arikawe, do you want to say something to that person?
Are you on a form of contraception? Because sometimes some of estrogen can actually cause breast pain, breast weakness, this kind of a thing. So sometimes maybe they need to give you a lower dose estrogen pill. That will sort that problem out.
Okay. She said she's on copper coil. She said she's on copper coil.
So I don't that's not connected. The copper coil is got no hormones at all. So that breast pain symptoms they're having is nothing to do with the contraception, because the copper coil is totally free of hormones. it shouldn't cause breast pain or breast tenderness or your breast to get fuller. So I think if you go to the GP, I hope you examine the breast. I don't know what age you are. If you're in your 50s or menopause, you need to be asking for a mammogram. You need to also check your own breast, make sure that you can't feel any lumps. If you can, maybe you need to go back to them again. I'll just say the problem is still there because the copper coil is not nothing to do with the breast pain or the inside.
Yeah. Somebody said she says she has and they have to. Okay, I think from all indications, a lot of women we tend to assume a lot that once something is not right and we are on a particular kind of contraceptive, we tend to assume that it is automatically the cause of our problem. From this now, I've just learned something new that we don't just because like myself, I don't really have pain or anything somewhere, but I have like a tummy. My tummy is getting bigger. I don't know how to explain that. You know,
You need blood test.
I don't even know. I don't. Is it the word bloated? Which I to be serious. I don't understand. So and I used to think it's because maybe diet and all of that, but I realized that whenever I have this on, it gives me like big belly, you know. And unfortunately, most of the time, these same men they were trying to kind of they were trying to kind of do all these things for because as far as I'm concerned, it's not just about women. The first thing tend to notice in you is that kilo shele ikun yìí ti tóbi jù and stuff like that, you know. Pure Hearts is just laughing at me now. Okay, I don't know if anybody else still want to say something. Do you want to ask questions? Because I'm going to go into my next question, but I want to ask people online, especially those that have joined the live, so please feel free to interrupt to ask your question if you still have any question. Kilisha says my tummy is over big after CS. Yes, I had 2 CS as well. Does anybody want to ask any question? If not, I'm going to go ahead and ask my own questions. Okay, yeah, go ahead.
Yeah. So you said like for me now when I did my implant, I added weight. So now that the implant is out, will I lose the weight? Okay. So it's interesting that you mentioned weight because I was just going to say to the host that I not talk about weight and contraception.
Okay.
That's something that comes to the So actually, the only method that is actually known to cause weight gain is the injection. Evidence-based that this will cause weight. So sometimes somebody comes to us, they're already overweight and they're concerned about gaining weight. I would say maybe not to try the injection because that can actually cause weight gain. So the other form of contraception, I've seen women saying that yes, they gain weight on the Marina coil, with the implant they gain weight. It's not usual, but again, some women are very sensitive to hormones. Any hormones you give to them, they start to retain fluid, and they will start, So, but when it comes to evidence-based, it's the injection that we know that definitely will make you gain weight. So the only questions, that's what we call as research. If you think it's the implant, because with the implant, once you take it out, the effect goes immediately. So that's why we say to people, if you're going to have your implant taken out or your coil taken out, maybe I didn't know at the beginning. Most of these methods are highly reversible. So it's not like, I don't want to use it because I don't want it to stop my fertility.
Okay.
People get pregnant on the coil, implant. So once you take out your implant, if you don't want to get pregnant, we advise that start to use condoms. Or use condoms 7 days before you come and change your coil or take it out because once you take it out, you can fall pregnant whenever. So the effect will be better. So if it's due to the implant, and you thought that was what made you to gain weight, you should lose the weight. That's the only way to know whether truly is the implant that caused it. So and then I'll just quickly mention this. I mentioned that most of these are highly reversible, that once you stop them, instantly you can get pregnant. The only one that will delay for a bit, again, is the injection. So before I give somebody the injection, I will not say to them that the injection can actually stop your period. And when you stop using the injection, it can take up to 9 months before your fertility can be reversed.
Really?
Once you have a baby immediately, yes. If once you have immediately, it may not happen for 9 months after you stop the injection.
Ooh.
And your period will not return for 9 months after you stop having the injection.
Wow.
Every other method, once you stop it, you can fall pregnant 2 weeks, 3 weeks after, whatever. depends on when you've had your sexual intercourse. You can fall pregnant, within a short space of time.
Oh, thank you, Dr. Arika. Precious, I hope your question was answered. Please, people, this is a TikTok live show. Yeah, this is a TikTok live show. If it's quiet, TikTok will push our live towards the back, and we'll have less people on board. Please keep tapping. Keep show love. Just hit the love button. Let's know that you're there. Let's make it active. Don't just ignore this. Please keep tapping. Let's tap let's so that TikTok does not push our what is it called now, they don't push it to the back. Somebody is trying to send me an invitation on Instagram. For some reason I couldn't accept you. Please, if you have a TikTok account, please join us on TikTok. I'm trying to accept the person, but Instagram is not allowing me. And please, people as well, the most important thing tonight again is for us to, as women, to be aware of our body, and to make sure that we do check and find out, and don't just, from what I've just learned tonight, from what Dr. Arika said, don't always just jump to conclusion that I'm adding weight because of contraceptive, I am having pain because of contraceptive, I'm over bleeding because of contraceptive. They said we should check, because that's what I would always assume. It could be because of anything else. We should always check. And she used the word insist, because nowadays when we go to the GP, they just dismiss you. They just, don't worry, it's nothing. Insist, because at the end of the day, it's your body. Insist, let them find out, let them check you, let them double check that it is not something else. Thank you, Pure Heart. Thank you those that are sharing, that are clicking on the heart, clicking the heart button. Please share the live show as well. Let other people benefit from this very, very informative live show. Dr. Arika, I want to find out, I know you'd already said it, that if people want to get pregnant immediately after they remove they shouldn't go for the, I was just going to ask that, they shouldn't go for the injection. Other ones, they can get pregnant as soon as they remove it, but the injection is not something that you should go for if you know that you want to get pregnant straight away. And you also said something, thank you for that information, because that was the next question I have here, that how soon can somebody get pregnant if they remove their contraceptive, which I've already answered. You said if you want to get pregnant immediately, you can go for any other one except for the injection. Am I right, ma'am?
Well, let me just reframe that. So what you would mean that if you want to get pregnant, then you stop the injection earlier.
Okay.
For instance, if you want to get pregnant, because the injection is given every 3 months.
Okay.
So you take it and then you don't take the next one or something like that, because it might take so with medicine that is never like 100%.
100%.
It doesn't that everybody that have the injection take 9 months to get pregnant. It doesn't matter that. Just that you should know that it take up 2 months, because what injection does that, it stops from ovulating. If you don't ovulate, you get pregnant and you're going to be able to, So what you may start ovulating before 9 months. So you say it will take up to 9 months if you stop the injection. So what people will do is, maybe you're trying to plan the pregnancy, you're going to plan it in another 6 months. Then you just take one and then go to the next one after the 3 months. So give yourself that time,
Okay.
Yeah, but it doesn't stop you from getting pregnant. It's not that you delay your or do anything to your fertility. Not at all. You will still be able to, that's it. None of them affects fertility. Basically, none of the methods affect your fertility. Okay. Any of the methods the only one that can affect fertility is tubal ligation, that somebody mentioned at the beginning. Tubal ligation is more like a permanent condition. Yeah. But any other method that is not permanent, you can always fall pregnant.
Thank you, Dr. Arika. Oluwatobi says, women, God bless us all. Amen. And ma'am, I was going to ask this other question. I saw a documentary about a particular woman online. I think she had 43 children by herself. She had multiple births, and I'm wondering, why would you continue to get pregnant when you know that you are this fertile? And this woman is not so rich. I was wondering, why would you have 43 children? Then, just towards the end of the documentary, we're told that this woman, no contraceptive had ever worked for her. So, and that brings me to the next question that I'm about to ask. Are there situations like that? Are there cases like that where no contraceptive work for a woman?
I don't know what she meant by nothing works for her. in the sense that she had side effects to most of the things she's tried. There are people that, like I said, they are highly sensitive. Okay, let me give an example. If a woman that is suffering from very every period, you probably will say, don't use it. But you're also very highly sensitive to hormones. Every hormone you try, if you give you a really, some women, the progesterone, they want to take something. You know, they get in a place where they are very angry, they get angry, they know they are anger outbursts. They literally said, I want to kill someone. When they put me on a progesterone. And once they stop it, they go back to normal. So it could affect some people in that regard. So if there's somebody like that, you bleed on some of them, or you very, very highly sensitive, almost they try to really like smoothers of women, you're highly sensitive. She had for something came. By the time she had like 10, she could do two, by the time she had like 6, 7, they could do tuber ligation. That's what they needed to do. So I think that next year they can cut her teeth and then she won't fall pregnant.
I think I also asked that question that why can't she do, I mean, you know, like we call it in a layman time, why can't she tie her tomb or remove her womb altogether? And I think towards the end of the documentary I was saying something like if she doesn't have those kids it does affect her or something like that. I don't know how far that is true, but she shall manage to have 40 something kids, which is kind of strange to me. That's just by the way. Then I wanted to ask about the implications of people that are not married, people who are not married, people who are not who are saying, well, I don't want to start having children yet. I'm not married. I don't want to start having children. They've not had any. You know that birth control basically is supposed to be something that space your children, or once you have enough, something that should, you know, make you stop having. But what about people that have not had any kids and they're having contraceptives to prevent themselves? They're sexually active, obviously, and they're having birth control, and they're not yet married. They're not even ready to start having kids. What could be the implication of this in the future? Would it affect their fertility in the future? Is it possible?
Not at all.
Oh, not at all. Okay.
So, because there are some young people, I've had like 12, 13, 14-year-old with very, very bad period. I mean, you know what women do through, you know, there are some young kids, I can't even know that. They put them on the pill, not because they need it for contraception, but they're using it for other gynecological issues. So it doesn't affect them in the future. Like I said, once they stop using the pill, they're fine. As long as I know we've already done all the whatever we need to do, make sure that there is no reason why they can't have it. There's no family history, there's no medical history. So yes, having contraception at a young age, you have young people, teenagers, being given the pill. You know, because they've tried the pill, they're still bleeding, they're bleeding. Because if you don't do anything else, what you're going to do to take out the womb. Some people really have severe bleeding that they're in so much pain. Before the advent of the Mirena coil, the option for women is hysterectomy, taking out womb. Things regarding the Mirena coil actually for me is God's gift to women. That's the way I put it. How many women have said to me, this thing changed my life? Because of their, some women have really bad period. They can't even go out of the house. It's so painful. All you have to do is to put this tiny little thing in their womb, and they're free. They can live their life again. And there's some young people like that as well. That you give them everything else, they're still struggling, you know, with their period. It's so painful. And you put this small coin inside, and they got their life back again. They can go ahead and do their normal duties, go to school, go to college, go to work. So it doesn't affect their fertility in the future. Even if they put them the injection, it doesn't affect their fertility in the future. It doesn't even take 9 months to get pregnant after you stop it. That's all. None of them can affect it.
Okay. Thank you so much, Dr. Agai. Then this is what I'm about to ask. What can we do, or should you please shed more light on these men contraceptives? Or contraceptives, no, I don't even know. Let's shed more light on it. Let's educate our men. Another thing is, a lot of times in when we have conversations like this, discussions like this, you see that 99.9% of everybody online are women. They're not even here to come and learn, you know, because in fairness, let's even forget about all these side effects and everything. In fairness, personally, I say to myself, now only we work out come, now we go ovulate, now we they go impregnate, now we go menstruate, now we go see give birth, now we go breastfeed, now we go shake. I mean, men should be able to do this one thing for us. I want you to please enlighten, or we don't know who is going to pick up this video. Somehow that they will see that maybe they are afraid, maybe they are scared that me more. I don't know. I don't know a man that will pick up this video somehow, so that they'll be able to know that this thing is not what they think it is. First of all, I want you to tell us why most men don't want to do it, the fear they have, or the misconstruction out there, and then tell us, shed light on it, what it is really for men, how it actually work for men, the available ones for them. I want you to please enlighten us on that now.
Okay, thank you so much. Okay, we talked about condoms, which, as you know, most men still say they can't use condoms. You guys find that it's fun. You can't use condom. I've been using all this and that's making me moody. You cannot use condom. Hey, that's life. I've seen men that say they cannot use condoms. Okay, fine. So condom is there, but again, it's still also not really as effective because you have to use it properly. You sleep, you must, okay, like that, you can't be pregnant. And again, don't give so condom is still not as effective. So somewhere we just say, you know what? Don't worry about the condoms. Let me do something because I don't want to get pregnant. At the end of the day, it's going to be too much problem. You're not going to be pregnant for 9 months and do all those kind of things. So the condom is there. Some men will use it. And if you use it well, it's highly effective. But if you don't use it well, if you sleep, if anything happens, if you don't apply it very well, the woman will get pregnant. So that's for that. Then we talked about vasectomy, which is sort of like a permanent one, like I said, even though technically you may be able to reverse it, but we don't advocate it because it may not be reversible. But it's a simple procedure. Like everything, fear of the unknown. I know men being men, Somebody said, hey, God knows why he created women and men like that. Imagine a man being pregnant. Just imagine a pregnant man. Just imagine a man pregnant. So, fear of the unknown. A man is worried that they're not used to women. We go through a lot. From the age of 12, 13, a girl is menstruating. You know what she's been through over lifetime. But they haven't been that kind of a thing to their boys. So saying they're going to do a procedure and they're going to do something down there, they're so scared. In fact, it's so interesting. In my surgery, we do vasectomy. So the lady that assists the doctor, I don't do it, the doctor does it. Said when the men are coming, we need to see their faces. That they always have this laugh. Guess what?
Like they are going on a death row.
I'm telling you, what that doctor did that made me laugh?
Yeah.
He actually had a candy or lollipop or something. You understand that he gives to the men. I'm like, are you stop it. And that lollipop to the men.
Wow, for one sticker. They don't give them sticker of well done, you are really good. They don't give them like children.
But you know what I do? When I see a man coming to me that they want to, I always actually encourage them. I'm like, I'm rooting for you. I'm saying to them, strong men have vasectomy because I know that their wives have gone through so much. So when I see a man, when they have to come to a doctor to have what we call a kind of counseling, you need to speak to them. Maybe that is what they really want to do. Have they finished completing their family? They're not going to come back and say we want to reverse it. Then you also reassure them it's a simple procedure. You don't need to be put to sleep. They'll give you a small injection to numb the area, put a really tiny incision, block that tube that carries the sperm. And before you know it, you're done. So I usually just encourage and say, you're done, you're doing the right thing, man. Go for it, you can do it, this is doable, you're going to be fine. Then they're worried about a lot of things. Is that they're going to affect their manhood? Is it going to affect the erection? Will they be able to ejaculate? All those kind of things. He doesn't, they're fine. Just say you're going to be fine. Within 2 weeks of that everything is totally ill. But then, after the bad vasectomy for a man, usually advise that they have to do tests on the semen about 3 times and make sure it's completely full of sperm. Before you can say the woman, you're fine. That man, you can now, the woman can now stop using contraceptive because the man now, you've done the test, and you're sure that they are totally free of any sperm.
So it's possible to do vasectomy and still have active sperms?
You need to wait for at least 3 consecutive times of testing and be sure it's totally free of the sperm before you can then say, you're free. You can go ahead, the woman can go ahead and stop any form of contraception. But it's very simple procedure. Strong men go for vasectomy. real men go for vasectomy. It's simple, it's straightforward, and you're doing something for your wife. This woman has struggled. Like Pebbles was saying, our body needs a rest.
Yeah.
I mean, that's it.
Yeah.
Saying that I've gone through. I just say to the men, just encourage that woman. Do something. Do that for her.
Yeah.
Vasectomy.
At
Can
least.
do it. It's straightforward. You will be fine. You know, we are sure that.
Thank you so much, Dr. Arikawe. This is a very, very educative section. I mean, one of the major things that is said here is the fact that it doesn't affect the erection, it doesn't affect how much they enjoy sex or not, it doesn't affect anything. It doesn't affect them from ejaculating and stuff like that, because there is a general misconception out there that nothing for you. You won't be able to sleep with a woman. I know that men don't joke with this thing that we're talking about. You know, and as you have said, he said strong men actually go for it. A lot of people think it's a taboo. But one major thing that I really want to emphasize is I'm glad that you said that there are what's it called now? There are a lot of medical research going on, so that there will be more options of birth control for men, which is great. I mean, it's high time. Come on now, it's high time. And a lot of people, when they don't find it, and some people don't even have access to this thing we're talking about. We are lucky that we're in the part of the world where we can access it anyhow. Some people are not even aware of it. Some people don't know. We have to understand that we're not just talking to UK audience, where we have access to GP, free, blah, 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 blah. And then we're also educated as well. I'm educated. I know I'm supposed to protect myself from getting pregnant. There are women out there who don't even have a clue. You know, people like that, we need to create more awareness. For if you notice, you know that people in rural area, the poverty-stricken area, pardon my language, are the ones that are really having so many children. Number one, some of them are not even aware that they can protect themselves from getting pregnant. Number two, even if they are aware, some of them don't have access to this thing that we are talking about. So they just get pregnant and they just keep having kids. And we know that apart from giving birth to kids in poverty and all of that, it is very risky to their life as well. Very, very dangerous, because keep going back to the labor room every now and again without proper medical care. Even where there is medical care, anything could go wrong. So apparently, it's something that is that we need to actually, I don't know how to create more awareness out there, apart from those of us who are in this part of the world where we are learned, we are educated, we have access to all this information. We also have access to medical care. So those are the people that I'm really much more worried about. Anyway, people like the rural area who don't even know how to go about this thing. Now, you did say something earlier as well, which I'm going to ask us to round up on that note, except anybody have something else to say, so that we can call it a wrap on this segment of this show today. You did mention something that... Does anybody want to say something?
Is that a question?
Yes, go ahead.
Yeah, please, doctor, you said something about the endometriosis that may also make people to bleed. I wanted to ask, if possibly, if somebody has that, can it only be taken out surgically? So, is there any other thing they can do to maybe reduce pain or stop it? I don't know. So the main endometriosis simply means that the lining of the womb is found in other places apart from the womb. So it can be found in the ovaries, it can be found on the bowels, it can be found on the pelvis. So when you are having a period, everywhere when you have periods, we are shedding the lining of the womb. So whenever you have that line, you're going to be getting pain. You can have pain with your bowels, you can have pain with your water loss to the bladder, you can have all sorts of pain. And if you have the lining of the womb called adenomyosis, which is a form of endometriosis, that also can be very, very painful. So there are medical treatment for it, and one of it is to stop you from having a period. Because if you don't have a period, you're not shedding any lining, so you don't get any problems. So that's why they will think about a method that can make you stop having period. And one of the things they can do is to put you on the pill, but tell you not to have a break. You know, when you have a break on the pill, you bleed. But for somebody with very severe period of endometriosis, just tell them to take the pill back to back. Don't get a break at all. breakthrough bleed, then stop for 4 days, and then start again. So any method that can stop your period completely. The marina coil as well is a very good treatment for endometriosis, because most women, like I said, 1 in 5 women will not get a period. And if you don't get a period, you're going to stop endometriosis, stop you from getting a period. And so any method that will stop you from the injection that we mentioned, most women don't get a period on that as well. So whatever stops you from having a period can help to manage the endometriosis. It's not always surgical. It's just because it takes a long time to make a diagnosis of endometriosis. By the time it's been diagnosed, you already have a lot of scar tissues and a lot of adhesions, part of the body joined together, causing a lot of pain. Women will need to have surgery. So it's not only surgery, you can do medical treatment if that fails, or sometimes then you go ahead and have surgical procedure as well for it. Okay, thank you.
Thank you, Dr. Harika. Does any of these lead to what we call fibroid?
No. Fibroid is completely different on itself.
Okay.
Fibroid is a benign growth. What happens that is not cancerous. One is a growth that happens in the womb or on top of the womb. And it's very common in women, Black Caribbean, Afro-Caribbean women. But we don't know what causes fibroids basically, but it's very common in there's a lot of theory that's been said as a cause of fibroid, but endometriosis doesn't lead to fibroids. But it's possible to have fibroids and also have endometriosis.
Wow.
Okay, but all these contraceptives now, what are the chances with all this one? What are the chances of someone having cancer on them? Because I think I did my research before I did my implant, and I saw that in the pamphlet, that was in Nigeria, the pamphlet they showed that it's cancerous too. Like that's I mean, how to put it, like, is, when they say reaction to something. Okay, so I wanted to ask, because is it true, and then what are the chances? Because even with the point that you're not having a regular menstrual flow, because the blood that's coming out, I think it's the dirty blood, like, or is it so it is still stuck there. You have an 8-year coil in your system. After bleeding for like 6 months, it stops. That's the marina coil. What's the chances that blood that is not flowing is not causing something else in the system?
Good question, though.
It's so good to ask this question.
Good question.
Let's attend to that. So, I'm going to say to you that not having bleeding is not a problem, and there's nothing called dirty blood, and it doesn't cause any problem. So when you have a period, like I said before, you are shedding the lining of your womb. That's what causes period. If you get pregnant, your lining will get taken up, nothing will be shed. So when you are pregnant, you don't get a period. But if you are not pregnant, okay, every month when you ovulate and there is no sperm meeting the egg, there is no implantation of the baby, that womb, we call it a disappointed womb, waiting for baby being come. So that womb will shed and you get a period. That's what period is. If you take any hormone, like progesterone for instance, that stops you from having a period, the blood is not storing in your body. It's not dirty blood. There's nothing dirty about the blood. There's nothing dirty about it. The blood is not being stored anywhere. And hormone will cause a problem. The reason why you don't bleed when you take some of these hormones is because the progesterone is not to fill the lining of your womb. So if the lining is thin, there is nothing to shed, and there's no bleeding that will happen. So it's actually very healthy not to bleed. There's nothing unhealthy about it when you're taking hormones. It's only if you're not on any hormones and you're not bleeding, then we are worried, because we know that your lining is getting very thick. And thickening lining is even not good. It's a risk factor for developing cancer of the womb, lining of the womb. If you're not taking any hormones and you're not having a period, we don't worry what's going on. It's to a scan. That lining is getting thick. But when you take progesterone, it's actually good for you because it fills the lining of your womb. And so that's how the marina actually works.
Okay.
You will release hormone little by little. So in the first few weeks, you're still bleeding because the lining is getting thin and thinner. When the lining gets very thin, to the point when there's nothing to check, also mentioned about cancer with some of the other hormones. What most people want about is breast cancer. There's a very slight increased risk of cancer by taking certain hormones. The risk is actually far less than you being overweight. A woman who has a BMI of over 30, you are like almost 8 to 10 times increased risk of having breast cancer than taking the combined pill. So you're not able to, well, there you have this weight which you are not addressing. Or if you don't do regular exercise for it, like sedentary, if you smoke, if you drink alcohol, they're not something that can increase the risk of cancer. But women, we just start talking about the hormones, and we're running away from it. Of course, if you already have a risk factor for cancer, for instance, with a genetic thing that you have a risk, that's why we say don't take these hormones, because you already have a factor of having cancer. I say to women, don't be too scared of this breast cancer, that you are now suffering in silence and not taking hormones that will help you for some of the symptoms that you are having. But as I said, it also depends on that individual. If you have any other risk factors, smoking is a risk factor, family issues is a risk factor, being overweight, drinking, so many other things. So there's a really slight increased risk, but it's not comparable to most of all these other lifestyle things that we generally address. So if you need to take it, I think I don't have any underlying background risk. That's why before they will do a check. Make sure it's safe for you to have it. If you don't take it, we will say to you, do not take it.
Oh, thank you. Thank you so much, Dr. Arikawe, because I'm not going to lie, I have to say that was a very, very good question, because I myself, I used to wonder, where does the blood go to? I hope it's not going to go and store somewhere, and in the future, it's going to cause the. So it's so important that you were able to, to shed a lot of light on that, and we really do appreciate you. And thank you, Precious, for asking that question. Yeah. Now I want to ask my own last question. I don't know if anybody else had any question. You did say that. Yeah. Please go ahead, Oluwa Toby. Yeah, please go on.
Yes. Good evening.
Good evening. Welcome on board. Yeah.
Yes, and I'm so happy to be here tonight.
Thank
This is
you.
my first time of ever being online anywhere.
Oh, thank you for joining.
I don't, go. But this is a very, very important and interesting topic to me.
Thank you.
Yeah. So my question is still about my breast. It's a bit, I'm really bothered about it because the own breast issue started when I started with contraceptives. So I started with the implants. I just noticed that I had fuller boobs, heavier boobs, and painful boobs. In 2023, I asked the GP booked me for an examination because I was having the scan at that time. I came back negative. There was nothing there. And I've always gone back there to tell them that, I'm having the heaviness. Like, normally I'm very positive, but now, it's more bigger and painful. Even my shoulders are, I don't know. And I've gone there, I've checked, no lumps, nothing, but the pain is there. It's bigger and it's heavier. So I don't know. The last time I went to the GP, what they told me was, I could start using Starflower oil, which I started. Okay. So, are you still on hormones currently, or you stopped all the hormones you're using? I have Coca-Cola now. As I said, Coca-Cola is not, I haven't got any hormones in it at all. Okay. When you want the hormone, the implant, that could cause heavier painful boobs because it's produced. Any of the hormones, some people do have issues with their breast when they take any hormone. Like I said, some people are very sensitive to hormones. And so the actually one is to switch you over to the copper core. So that shouldn't be causing the problem with the boobs. So if it's still causing that problem, like I said, I don't know how old you are. If you're maybe 35. Okay. So, you're still young, which is good, because most postmenopausal women anyway, they do get issues with problem with their breast. The good thing is that breast pain without lump is good news. because most of the time it doesn't really equate anything sinister, but not 100% of the time. And considering your age, if you haven't got any family history or any other risk factor of anything sinister, that's also reassuring. So sometimes some of these things, it could be other things that is causing it. Some people have just cyst, which is, they call it fibrocystic disease of the breast. If this thing has gone on for so long and you tried everything, you changed from the moment you're still having a problem, there's somewhere called the breast clinic. You can ask your GP to refer you to the breast clinic so they can have a look at you as well with full life details. Your copper coil has got nothing to do with it. I was getting scared and I was saying I was going to get it off again. Please don't take it out. If it's working for you, if it's not causing you any...
If you take it out, I can't even twin size come in the end.
Unless you want to have a baby, then take it out. Otherwise, I would say let them to fight the best. Let them see what else is causing the problem.
Yeah. Thank you, Dr. Arikawe. I hope your question was answered, Oluwatobi. Please, yes. Dr. Arikawe, I want to ask this question as well. Some contraceptives, as we have rightly said, stop people from bleeding, and maybe after you've been having, for example, let me use myself as an example. I've always had implant, and I know I'm over 50 now, and I've never ever been bleeding. I'm thinking, okay, I'm no longer a child. By 50 and above, I should have reached menopause, because I can't tell, due to the fact I've not really been bleeding. I can't really tell if I'm already that menopause. I know people, some go to menopause late. Some people do it as from 40, 45. So, and I'm thinking, go and come out this thing, Jerry. You don't really need it anymore, because but how do I know if it's menopause that is now stopping me from bleeding, or it's still the implant? If I remove it, is there a risk of I want to be 50 something. I want to watch a school run at 50 something.
That's a really good question. Lots of women worry about this. What is fast of contraception? And as you rightly said,
somebody said, yeah, baby. Pure hearts, behave yourself, but let's see, yeah, baby.
We usually advise, what they call it, the Faculty of Sexual and Reproductive Health Advisor, a woman can reasonably stop contraception after the age of 54. That's when we know that the chances of getting pregnant is really very negligible. It's not a high risk, but we've seen women getting pregnant in their 50s, especially if they haven't gone through menopause. And you are so right. How do you know when you're already on a method that stops you from having bleeding anyway? So, all people will know is that if you start to get symptoms of menopause, you can't suspect it. But even if you do get symptoms of menopause is not something that does happen instantly. It's a gradual process. Some women will take 5 to 7 years. So we call it perimenopause. Around the menopause is 12 months after you haven't had a period. That's if you're not taking any contraception and you're over the age of 50. Also, it's difficult to say. Obviously, what we say is...
Somebody said they got pregnant at 54. Don't scare me, oh. Yeah. 54! Oh, jeez.
After the age of 54, after the age of 54, you can stop having contraception after the age of 50. After your 54th birthday, you can stop having contraception. But we've known, actually, Black African women sometimes have late menopause. So if you're still having a period at 54, then you know you are not menopausal, so you should continue using contraception at that time. So for a woman who is worried, what you could do is, if you don't want to use any of the method again, you could take them off, stop them, but use condom. That's if your partner will to use condom. Like I said, some men don't want to use condom. Or if you're still that desperate, you decide to take it out and then ask the GP to do a blood test called FSH. To find out where you are. We don't usually...
So there is a blood test that one can find out. FSH.
Okay, and being careful. I'm being careful saying that. You know the reason? Because you don't need a blood test to diagnose menopause. Menopause is a clinical diagnosis. So women come to us and say, "Can you check where I am?" We say you don't need it. Especially if you're over the age of 45 and you have symptoms of menopause, we won't do blood tests. We'll just say yes, it's menopause. The only reason why we do it is if women is trying to see should I stop contraception or not, I don't know where I am. That's the only reason. I don't want people to take this slow. When to meet that you can say one doctor said I need to do blood tests to check. If you come to me actually as well, I don't offer blood tests for women over the age of 45 because I said you're over 45, you're having symptoms of menopause. It's likely to be because the blood test is not as reliable. It fluctuates so much because our hormones are all over the place around that time. Like I said, the only time when we would offer you that blood test is if you are for any reason want to stop desperately and you don't know whether you've gone through menopause or not, and you really don't check. We may then decide at that time to do it.
Thank you.
And then you need to do 2 tests 6 weeks apart. Because the blood test can be a bit all over, it can be low, it can be high, it's just a bit all over the place. So that's the only time.
There's no assurance. Thank you so much, Doctor.
Carry on with your contraception. Most of the methods, you can use them up to the age of 55. The only one you stop at the age of 50 is the injection and the combined pill. But your implant, you can carry on till 55. Any other method, you can use it till 55. But the injection, we say stop at the age of 50. The combined pill, the one that's got estrogen, you have to stop at the age of 50 and switch to like a mini pill, the one with progesterone.
Wow.
Just because of the risk involved with taking them at the age of 50.
Wow. Thank you so much, Dr. Aida. Somebody said they had a baby at the age of 54 and the baby is now 2. And then I think the person is trying to tell us what FSH means. She said follicle stimulating hormone. And then somebody said, but why can't men do it? That's what we've been talking about. Unfortunately, the way God made them, we refuse to do it. We are the one that will suffer for it. And I also want to ask just last 2 questions. I'll ask both of them and then you can answer them one after the other so we can call it a wrap on this show. It's been an amazing time. And the first one is it possible to have a contraceptive in your body and it is already overdue? Well, as in, expire? Yeah, because some of us don't even keep record. For example, I can't remember last time I had this thing on. If it expires, you didn't remove it, but it has expired, could it lead to pregnancy? Number 1. What's the implication of that on your body? Number 2. And finally, you did set something that all of these things, they are not 100%. The only 100% is abstinence. Women of God on this wonderful platform, can you guys abstain completely? If we abstain, what will happen to, if it's okay, I don't want to do, I beg, don't touch me, I don't want to get pregnant. What's the implication of that on our men? Can they also be able to do that with us? So, first one, when contraceptive expires and it's still in the body, what's the implication on our body? Number 2, when it expires, could it still work? Or there's likelihood that although you have it in your body, but you can get pregnant. And the last one is this abstinence of a thing. I want to hear from people. Can you actually abstain, guys? So.
Thank you so much. So when it expires, the implication on your body is pregnancy. That's the only implication. You will just come and you're pregnant because you're meant to have been for 3 years, you've had it for 4 or 5.
No,
you're not working anymore and get pregnant. Well, they've extended the use of the code to 8. It used to be 5 for the Marina Cup. It's now been extended to 8 years. So if you have it for longer than that, the implication on your body is pregnancy. So it's important to keep notes. Most GP will take notes, but when they give you a look, they give you a small card, a reminder card.
What card it is on?
I know. Call your GP. They will check on their record. Can you check when I had my implant? Can you check when I had my coil fitted? And even with injection, if you don't come every 3 months and you come late before pregnant, if you don't take it as a shield before pregnant, so any of them, if it goes past the time you're meant to change it, the implication on your body is pregnancy. The abstinence I mentioned, we are not advocating abstinence for married women, except it's like consent between both the husband and the wife. Don't cause trouble in homes. And Dr. Abika did not mention that women should go to their husband and say, the only 100% is is abstinent, so don't condemn me. I did not say that. So that's why I mentioned what.
Hey, girl, people, can you people not abstain? Somebody said they did somebody did this for 7 years. They were celebrating for 7 years after my son. But men, somebody said if you abstain, your God go visit your friend Jesus. I said.
That's why I did not say if you abstain. If you are married, you are in a relationship, it has to be between you and your husband.
Wow.
That's what you want to do. That's why I have all these methods. That's why you should find something to use, or let him find something to use so that you can enjoy. Because again, when you're too worried about I don't want to get pregnant, then you enjoy out of sexual relationship because you're worried I'm going to get pregnant. Then you don't enjoy it. So that's why it's better to have peace of mind. Let's go and do vasectomy. Find the method I see to me so that because this thing is given to us by God to be enjoyed. So that you want to enjoy it without I don't want to get pregnant. And it's a valid fear. I don't want to get pregnant. Especially if you've had so many kids or you've had lots of problems with pregnancy. So it's good to just either he goes and have vasectomy or you go and get one of the methods. So abstinence for many people, that's not what I've said.
So nobody should go and post Dr. Arika.
It's not me that said that.
Don't let your husband start carrying a shakabula to go and meet Dr. Arika in the office and say, hey, Dr. Arika, you're the one that told my wife to abstain. Wow, people. Yeah, thank you so much. People, please, I just want you to just tap, show some love. Let's appreciate Dr. Arika Way. It's been an amazing evening. Thanks to those that joined us on this live show. I don't know what I did wrong with the video. I'm relatively new on this thing, so I'm going to work on that next time. Thank you, Dr. Arika. We really do appreciate you for your time, for taking time to thoroughly explain all of this to us. It means a lot to us. Anyways, people, I'm going to let Dr. Arika tell you how you can find how you can find her on her social media page, because she's also a Christian. I know this is not a Christian talk show, but I'm a Christian and she's a Christian, but a Christian. She does have another page where she talks about women, health, and faith. So she's going to tell us where that is on Instagram and of course on TikTok as well. We can follow Dr. Arika. Please give her a follow, and let's just appreciate her. On one of these occasions as well, we are looking forward to that. I'm hoping I'm going to be able to bring her back here to come and talk to us about other things, especially the opposite of what we are talking about today, fertility and how women can get pregnant, what can help you to get pregnant, and also maybe probably in the future, if she has the opportunity, she probably will be able to come back here and talk to us as well about how to enjoy your sexual life as a woman. And because a lot of women don't enjoy sex, they say it's but that's not a topic for today. We hope that we'll be able to get the attention of Dr. Arika, because she's a very busy woman. For her to take 2 solid hours of her time, gosh, that's a lot, and we appreciate you, man. Please tell us, people are saying thank you, people are sending you appreciations both on Instagram and on TikTok. People are saying thank you so much. We really appreciate it. I really am particularly humbled to have you on this show and for taking this so much time to explain all this to us without hurrying off, without saying I have to go. Thank you so much. We appreciate you. Please tell us your other platforms where we can reach you, and we have a program that we do once in a year as well.
Okay, yes. As you said, I'm a Christian, so I'm passionate about women's health, women's spiritual growth. Yes, so I have a prayer platform called Sisters Pray, where women come together to pray. As you can see, all the issues we go through from one thing to the other, Or we can pray, and great things happen when women pray. So it's a platform for any woman who wants to pray. It doesn't have to be any denomination. It's once a year, and it's always on the first Saturday in April, and it's over Zoom. So do join us next year, 2026, for an edition of So I have a blog where I write on women's health and faith. I have topics of all sorts: pregnancy, menopause, prayer for your kids, your grandchildren, your children, faith prayer, on all sorts of things that has to do with women. And it's on www.wordforher.com. Word for her, because I believe God has a word for you as a woman. I could see lots of my ladies here talking about it, even with contraception, but just to encourage you, God has a word for you. Don't sometimes they want to feel, how come I have to go through all of this? Women have to trying to get pregnant, even when you're pregnant, there may be issues, or you want to have a child. So God has a word for you. There's a word for every woman. And that word is a word of comfort, a word of encouragement, a word of upliftment. So on my blog, I write on issues related to women. So you can go on, you can actually go on my website, and if you click on the link there, you may just become a subscriber, so that when I write, you will be notified. And I also write encouraging emails maybe once every 2-3 months. That's what I have. So I'm on Instagram as well, and Meettheroyals made me reactivate my TikTok so that I can do this.
Yes, please.
Reactivated it as well.
Yes.
But hopefully when next I come, Meettheroyals, I can actually, you can see my face.
I don't know what I did. It's so painful. I don't know what I did.
And everything. I quickly came back and put my makeup on.
I can imagine. I try to fix it. I don't know what happened.
I'm not to see my demo. Next time, the video will be like, I'll come to connect with you or you work for her.
Yeah.
Go to my website and subscribe to my blog. Thank you so much for having me.
Thank you. Thank you, Dr. Arikawe.
Go away, ma. Just a quick one. I know I've been quiet because when you meet someone that knows
their stuff,
just correct and learn. This is not about contraception this time around, it's about menopause. Because I just want to still your indulgence. I know sometimes menopause would make you have so many nasty hormonal imbalance. But does it also make you fat, your times 2 of your normal size? And what can be done if it does? And if it is not, could it be something else? Because I am the bearer of the 2-year-old.
At 54.
I am a grandma and I had a baby uncle.
So yes, people, when you go to menopause, yes, you can gain weight. Because as you drop your estrogen, less estrogen actually leads to weight gain. And so that's why I say to women, when we start to get to that age, perimenopause, we need to start to look at ourselves really well. Because some things are outside of our control. That's the time we want to get healthy. Think about yourself, not about the whole world. Begin to become physically active, begin to check what you're having. Because no matter what you do, this thing is not outside of your control. It's just your hormones making those things happen. But again, you also said something, is it menopause or something else? In fact, that's what I'm talking on my blog. Is this menopause or something else? Yeah, there are lots of other things that women can have that can cause some of these symptoms. Like underactive thyroid, for instance, you can gain weight. And the symptoms can overlap. So you think it's menopause, but something else. It's thyroid hormone. So I would say, when you have that, maybe let's get to the GP, get some blood tests. Every woman from the age of 50, I think, go and have like a general health check for diabetes, check for thyroid, check for your cholesterol level. Just look after yourself. From the age of 50, let's begin to become intentional about our health, about making sure, because a lot goes on. Our mood is affected, your body is affected. It's just so much. But like I said, you can actually go through menopause and have a positive experience.
Yes.
So that makes it possible, but there could be other things. So please go and get some blood tests, check thyroid, check for diabetes, just do all those tests. So that you should, I think it's menopause, you need to have a HRT if you are suitable for it. That would mean sitting with a menopause specialist to go over your options or any other option that's available. Thank you.
Thank you so much, Dr. Arikawe. We have to go in the next 5 minutes. Did you want to still ask anything, Lucilicious? No. And I want to say as well, she has a book, an e-book that you can grab on Amazon, and it's called How to Make Menopause a Positive Experience. That book is fully loaded. You get a lot of information, both medical information and faith-wise, So please, if you want to grab that book, it's an e-book, and I think it's just less than £10, not even a lot. So you can grab it on Amazon. How to Make Menopause a Positive Experience, and it's by Dr. Oluseyi Arikawe. So thank you so much, everybody. It's been an amazing evening, Dr. Arikawe. We really want to appreciate you. Thank you for always. And I said we are coming back again. Don't be tired of us, because every time you come, we get blessed. We really do appreciate you, and to everybody that has joined us tonight, I want to say thank you so much for joining us tonight. Hey, every much man sorry to you lost us a bit, but
Sorry for interrupting you. Just before you go, I just wanted to acknowledge Dr. Arika. I've listened to, I didn't start on time, but the ones that I've heard are quite informative and educative. So I just want to appreciate Dr. Arika. Thank you so much. And thank you, for always bringing,
Thank you, sis.
Thank you.
Oh.
Bye-bye.
Oh, God bless you, sis. That's coming from our beautiful Kemosi Total event, ladies and gentlemen. I really appreciate you, sis, for always and for supporting us on this show. I have only set this live on 2 hours, which I'm going to stop doing so that we can have more time, because after 2 hours, I'm going to cut us off because I just set it on 2 hours. And I really want to appreciate everybody one more time. And those that are appreciating Dr. Arika, we thank you so much. We really do appreciate you. And ó máa ń wuni ká jẹran pẹ́lẹ́nu àmọ́ òun fa ọ̀nà fún yìí náà ṣá ó ní kì í gbà fún wa tó bẹ́ẹ̀ jù bẹ́ẹ̀ lọ Yorùbá náà lọ tọ́bọ̀ tán ní pé kì í dùn kó pọ̀ bẹ́ẹ̀ ni kò ń pọ̀ kó dùn ṣókí báyìí òun lọ bẹ oge èmi Olúwabùnmi aya Òṣìbẹ̀rù mo tún wá sọ fún wa lénìí wípé lílọ ni mo tún ti ń lọ yìí ogun ó lọ kò dé kò ní bá mi ogun ó dé kò bá wọn kò ní dé bá yín mo gbàdúrà pé ayọ̀ ìdùnnú àti àlàáfíà tí màá fi yín sílé ní òun náà ni màá tún padà wá bá yín lọ́jọ́ mẹ́jọ lágbára lọ́wọ́ Ọlọ́run. We're gonna be here next week again for another intriguing topic. Please don't forget to join us. Mo wá fàsìkò ẹ̀sìn gbogbo wa wípé láyọ̀ la ó máa pàdé o mo ní láyọ̀ la ó máa pàdé o ẹ̀yin ò ní forígún èmi ò ní fẹsẹ̀ kọ o mọ́tò yòówù ká lè wọ̀ kò ní forí sọ̀gì o láyọ̀ la ó máa láyọ̀ la máa pàdé láyọ̀ la ó máa pàdé. Thank you so much, everybody. See you next week by God's grace.
Best of traditional wedding. Gbogbo lólùfẹ́ ń retí rẹ̀. Best of traditional wedding. Ẹ̀bùn lóríṣiríṣi many gives away. Best of traditional wedding.
Thank you so much, everybody.
Kí lorúkọ ètò náà? Best of traditional wedding. Ètò ìgbéyàwó tó bọ̀ ní lọ́gbọ̀n. Best of traditional wedding.
Jẹ́ ti gbọ́, ètò lẹ́sọ̀ traditional wedding ló lọ lọ́wọ́.
Ó yá jíjẹ.
Kí lorúkọ ètò náà? Best of traditional wedding. Ètò ìgbéyàwó tó bọ̀ ní lọ́gbọ̀n. Best of traditional wedding. Every Tuesday on Instagram. Every Tuesday on Facebook. 6 p.m. UK time. Every Tuesday on Facebook. Ètò ìgbéyàwó tó fún mi lóye. Best of traditional wedding. Ètò ìgbéyàwó tó fún mi lóye. Best of
Traditional wedding. Thank you so much, everybody. See you next week by God's grace. God bless you. Bye.